Morning, ladies and gentlemen, welcome to the Public Safety Committee for Washington County for May 2025. This committee is in order. This meeting has been noticed appropriately through the clerk's office. We have 4 members present and 1 for the votes unknown. And we will continue with a moment of silence during the pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Item 2 on our agenda is the minutes from April 16th. Did anyone notice any items that needed to be corrected before the please? That doesn't place on the file. Moving on to item number or agenda 3, discussion of possible action. First item is for the medical examiner office recognition by American Tissue Services Foundation. For that, we have our medical examiner, Debbie Stoll. Welcome.
I have a guest speaker here with us this morning, so it's Pat from the American Tissue Services Foundation, who's going to speak a little bit about the recognition of the award, and then we'll see if there are any questions.
Thanks, Debbie. Can everybody hear me okay?
We can, thank you.
Okay. So my name is Joyce Kratz from American Tissue Services Foundation, and thank you very much for giving me this time this morning to talk about the recognition that the Washington County Medical Examiner's Office has received from our office. And we really want to thank the staff and absolutely the leadership provided by Debbie Stodola, the medical examiner. So Debbie, did you bring the teardrop and the certificate?
If not,
Okay, all right. So we did actually present the award to the staff, and the sheriff and the public safety manager were there. We wanted to do it a little informally for the staff to make sure that they knew how much we appreciated them. So we really want to let you know the Teardrop Award is an award for the recognition of tissue donation efforts by the Washington County Medical Examiner's Office. And what the teardrop actually stands for is, obviously, in our grief, when a teardrop drops into a puddle of water, it's ripples. So those ripples absolutely extend out, not just in the immediate time, but for future. So we really wanted to make sure that you knew how compassionate your staff is and the compassionate care and support that the office provides to donors, but also anyone who has lost a loved one. And that's really what we want to base this on, is the tissue donor heroes, but their families, because they are really going through the darkest hour, and your staff does an absolutely phenomenal job. Little interesting fact, I hope you find it interesting, is Department of Health Services once a year actually goes through the DMV and all of the donor registry statistics. And the state of Wisconsin statistic as of now is 57% of people 15 years old or older have made their donor designation that they actually want to be a donor. What I find is very interesting is Washington County is one of the highest counties in the state, and you guys actually have over a 61% of your residents 15 years old or older have stated legally that they want to be a donor. So to me, that definitely shows you've got a very caring community. So I just wanted to bring that out. Last year, we try and not focus too much on statistics, but this one just really hit me. So with the number of actual donors that the Washington County Medical Examiner's Office called into us and became donors, over 675 individuals were impacted by those gifts. So not only did the staff provide compassionate care to those donor families, but when you really look again at that ripple effect, 675 people were impacted by that. So to me, that just, is what this is all about. So the impact this office is having on tissue donation will continue to have an impact for years to come. So it's my distinct honor to present this award to the Washington County Medical Examiner's Office under the leadership of Debbie Stadola. So Debbie, congratulations to you and your staff. You definitely earned this, and I appreciate our working relationship. Did anybody have any questions or anything I can answer?
Anything from the committee?
What is the range of impact? Is it just more Wisconsin or does it go farther than that? I'm just curious.
Yeah, I'm glad you asked that. Normally we do go through surgery centers in the state of Wisconsin. However, we do provide tissue all throughout the country and also internationally. So it can, as they say, the statistic is one tissue donor can impact 75 or more lives. And I know for a fact that there have been multiple donors out of Washington County that it has definitely been well over 75 individuals. And that number is truly based on the number of gifts that they can donate due to their health and their age. It also is dependent on what a surgery center is projecting their needs for surgery for the next couple of years. The gifts of tissue are viable for up to 5 years. So that's why when we say 75 or more individuals, the impact is for many, many years. Did that answer your question?
Thank you, very interesting.
Okay.
Any other questions or comments? With that, congratulations, we owe you a round of applause.
And again, thank you and congratulations.
And again, it's important, your leadership and your attitude in helping your staff understand, and helping the community understand the importance of tissue donation is a great thing for Washington County and obviously fits with the sensibilities of the county if we are at 61% who are donors already. So thank you for furthering that goal.
Yes, thank you. And Joyce, thank you so much. You and your teams are so easy to work with. It makes it easier for us to make that one extra phone call at 2 in the morning.
Thank you. Congratulations. And I'll let you get back to your meeting.
Thank you. Is there any, are there any questions or comments for you? Not all in favor, say aye.
Aye.
Any opposed? That motion carries. Moving on to item 3C, fire and EMS updates, and we can again to Mr. Sager.
Thank you, Mr. Chairman. As we all heard, the county executive speak at the last county board meeting, the extensive, concept, if you will, moving forward to create a regional regional EMS system throughout Washington County to be able to assist the needs that the fire departments are facing currently. We do have a subcommittee, as described at the county board meeting, that is currently in the process of formulating a strategic plan for the recommendations that have been put forth by healthcare strategists. And we do have a county chiefs meeting tomorrow night, where we will discuss that even further.
Any questions or comments from the committee? Thank you for that update. Moving on to item 3D,
Okay, you have all received the analysis that I put together in a spreadsheet for each municipality. To the city. It gives you a deeper dive, just to dovetail on what Ms. Crash just stated. This analysis is all statistics, it's numbers, numbers tell a story. And by having that information in front of you, they'll be able to give you a deeper concept as to how you will develop your decision-making going forward in this process. And I'm available for you at any time to answer any questions that you may have as you go through that. It's very comprehensive. There's a lot of information in that document. So if you need any guidance or assistance in going through that, I did provide you with some information this morning from West Bend Fire. As you all know, West Bend Fire and Police are currently not within the Consolidated Dispatch Center. So those numbers are drawn from what they use called First Due. They do not use the system that we use, where I was able to glean the information that I provided to you. But it gives you a comprehensive 30,000 foot view of what West Bend Fire does just in their municipality alone. West Bend Fire does respond to multiple townships, villages throughout the county that we're able to capture through our dispatch center. And that's the information that you have, but that in front of you is from the city of West Bend solely.
Thank you for sharing that. At this point, we're not gonna entertain questions about the details of any of the numbers or anything to that depth. But if anyone had questions for Mr. Sager about, the format, what any of his abbreviations meant, just general questions like that, we entertain those at this time.
Thank you.
Go ahead. Thank you, Roger.
So I've attended a lot of these meetings in the past with fire departments. And I haven't attended the subcommittee meetings. Do you feel there's cooperation and buy-in from, I would say, the fire side of it, fire and EMS, and not the municipalities, but because the idea that's out there now is the regional EMS stuff. I'm wondering how that's being received on that end, behind the scenes, like, was it?
Well, before you answer, we really, we're just gonna focus on the format and the report itself to see how. If there were questions about getting the information out of the report. I think it's a little bit premature to say how any individuals or chiefs might feel about that, but. I understand your interest and I understand your curiosity on the topic, so. We're not gonna delve into this very deeply, but if you could give us a succinct answer, that would be great.
As succinct as I possibly can, I think it's being very well received. I know that at the subcommittee level, it's just the fire chiefs that's been put together by career departments, combination departments and volunteer. And they're working together very well. It was a group that was both volunteer and suggested by the entire county chiefs. So as the executive said, the Washington County Chiefs came to you as the county board seeking assistance. So with the study, the expenditure for the study, and the results of the study, and now a plan put in place, it's well received. So we'll move forward with it. It's gonna take a lot of communication and understanding in that regard, but I think that it will have a positive outcome.
Any other questions? So yeah, there's a lot of data there for us to now remind them and do our work and get our questions. Figure out where the individual areas that we represent as supervisors, how they, what their statistics are and how they'll be affected, but also as members of this community, look at the overall county and see how things work out. So we do have a bit of work in front of us to review those numbers and see how things fit from area to area and district. Anything else on that?
No, sir.
Thank you. Then, our next meeting date will be June 18th, and we perhaps will have more information then at that time. At this point, we would entertain a motion to go in closed session for the purpose of hearing the jail as required by Wisconsin statute.
I'll make a motion.
Thank you.
One second.
Second from Peter Dudrow. You'll take a roll call vote, starting with Supervisor Coleman. Yes.
Aye.
Aye.
Aye, I apologize, I did not allow time in there for discussion, if anyone wishes to discuss further and change their vote, this is something that is required. Being no objections, we will, go into closed session. Captain Lehman is here and will take